Hello, here again we have a coronal section of the brain, and we are able to see the lateral ventricles, and this would be the region of the basal ganglia bilaterally. So there is a very obvious localized abnormality, and what we see here is this very dark, almost blackish area of discoloration. Let's take a closer look. What we are seeing here is an area of hemorrhage into the brain parenchyma. So when there is hemorrhage in the brain parenchyma, we call this intracerebral hemorrhage. Much of the time, intracerebral hemorrhage may not be traumatic in nature. There may be some underlying abnormality in the cerebral blood vessels that gives rise to hemorrhage. A very common cause of this would be hypertension. For example, it can give rise to aneurysms within the small vessels, often in the region of the basal ganglia, as we see here, and those are called Charcot-Bouchard aneurysms. Those can rupture and give rise to intracerebral hemorrhage. Let's take a look at the opposite surface, and if we look here and zoom in, we can actually see that this area of hemorrhage has extended into the lateral ventricle. So this is not only intracerebral hemorrhage, this is also intraventricular hemorrhage. So if you want to think about what are the clinical manifestations or effects of this actually would be considered a hemorrhagic infarction. So there would be necrosis of the brain parenchyma giving rise to localizing signs. But in addition, just looking at it, you can see that it's already pressing a little bit onto the lateral ventricle ipsilaterally, and it's altering the shape. So there can be raised intracranial pressure because this is considered a space-occupying lesion. Remember, raised intracranial pressure can be due to increased fluid or tissue within the intracranial cavity. And of course, with raised intracranial pressure, there is a danger of cerebral herniation. And if you work this out yourself, when there is blood within the ventricle itself, this will eventually lead to clotting and can give rise to obstructive hydrocephalus. In addition, the blood products will eventually become organized. There will be fibrin deposition as a result of clotting, and there will be organization. And sometimes these can also obstruct the arachnoid granulations through which the CSF is absorbed. So eventually, in the long term, this can even give rise to communicating hydrocephalus. So just to summarize, this is a specimen. This is a coronal section of the brain showing an area of intracerebral hemorrhage into the region of the basal ganglia with extension into the lateral ventricle, causing intraventricular hemorrhage. And the most likely cause in this instance is hypertension. It would also be important to note that this is considered a hemorrhagic infarction because the area of hemorrhage also gives rise to necrosis in this localized area.